I'm Brooke Abbott.
And I'm Amber Tresca, and we're the co-founders of IBD Moms. We're moms and inflammatory bowel disease patients, and we've created a safe space for other moms with Crohn's disease or ulcerative colitis to share their journeys with one another.
The IBD Moms podcast will focus on topics such as body dysmorphia, sex and intimacy, how to parent through a flare-up, and transitioning kids from pediatric care to adult care.
Thanks for being with us. We are here to help moms on the challenges they face on their journey through motherhood and chronic illness. Hey, Brooke.
Amber.
We had our friend here to have a conversation with us about transitioning care from pediatric to adult.
Yes, which is such an incredibly important topic just because no one really talks about it, but it is a thing and it's absolutely necessary. And I feel like it's one of those topics where everyone's kind of thinking about it, but not talking about it. So I'm glad that she came in and sat down with us for a little bit.
Yeah, so our friend Stacy Dylan of Connecting to Cure Crohn's and Colitis, she has a child that lives with IBD and he's now a young adult. So she is really in the middle of this process. And not only that, but she talks to a lot of other parents who are dealing with it as well. And so she was able to give us a firsthand account of how she's dealing with it in her own family, and then also how some other parents have thought about it and dealt with certain things and then have related that information to her.
This is just something that I think we as adult patients have all hoped that parents who have pediatric patients would have this type of resource. So we're happy to bring it to you.
Coming up next, Stacy Dylan from Connecting to Cure Crohn's and Colitis. Stacy, thank you so much for sitting down with us and talking to us about the transition from pediatric care to adult care in kids. And I know that this is an important issue to you. Can you tell me why it's an important issue to you?
Sure. So I founded Connecting to Cure Crohn's and Colitis, and one of the reasons why I started it, well, the main reason was because my son, Lowell, was diagnosed with Crohn's when he was very young. He was 2. He's now 22, so we just had our 20-year anniversary of his diagnosis. And I would say about 10 years ago, my partner, Dana Zatulov, who I started it with, decided we wanted to do more and be around do more with fundraising for research. And then, of course, as our community started growing, we realized that there's a need for more programs for patients and especially for caregivers. We really focus on caregivers. So we have, support groups and other programs that cater to the needs of patients and caregivers. And of course, as I've met more moms and parents who are dealing with kids at any age who are diagnosed, one of the big, stress points can be when they're transitioning from even before they have to maybe get an adult GI doctor, but just as they're becoming teens or going off to college and, they could be on a biologic medication that's an infusion, and where are they going to get that? And how are they going to manage all of these things on their own? So it's definitely, as your child gets older, it's something that you start thinking about and start planning for. So this topic is very important to me, myself, as I'm in the process of doing that with my son, but also the people in our community that are dealing with this.
Stacy, when did you start kind of prepping your child to start transitioning? Was there a time when you thought, okay, now we need to start kind of prep, or did it just happen naturally?
I think that's a good question because I think our story might be a little bit different just because my son's disease has been so severe. So he still lives at home with us. So he hasn't left. And so he hasn't had to deal with as many things on his own. But that's not to say he already does deal with a lot. He already does deal with a lot of things on his own. So I feel like for me, it was probably a little bit later, more before he was turning 18, because I knew at that point I wouldn't have access the same way that I did when he was younger because of just, the privacy and HIPAA laws that doctors and even the insurance company and the specialty pharmaceutical company, they're not going to talk to you unless he gives permission. So it was probably around then. But I would say in terms of parents in general dealing with this, it really does depend on the age of your child's diagnosis. So, it is more common to be diagnosed with this maybe during that time when you're an adolescent or before you're an adolescent or, 12 to 18. And so if the child is 16, 17, or 18 and getting diagnosed, they might already be prepared to deal with things on their own, meeting with a doctor who's already going to be addressing them more. But if have a young child, mine, or, there's also a lot of families that I know that their kids were diagnosed that young, or 7, 8, 9, the child is really not equipped and doesn't understand. And so when the parent takes over, it's sort of a natural thing to keep doing it. So for me, I think it was more something that I had to work on to give him the skills, to make sure I was giving him the skills to do this, because I was just so used to doing everything. And I think that one of the things that has been positive for us in our relationship is modeling. And I was talking to you a little bit about this, Brooke, anyway, in terms of just being a parent with your child and how to have them advocate for themselves. Like they see you doing it, When Lowell first had to stay in the hospital by himself, it was like very anxiety provoking more for me. Yeah. But I was proud of him because I felt like he knew how to ask the right questions and say the right things. And don't, if someone comes in and wants to do this or that, you can ask, why are you doing this? Does it need to be done? And so I think that I tried to be a model of that for him and so I started thinking about it around his teens, because I knew that he was going to be the one who was going to have to deal with this on his own. So I think it's important to be a model for your child in that arena, and it's important to advocate for yourself, and it's important to show your child to advocate for themselves in any area. But if you have a chronic illness, it's really important. So,
Do you have parents that are struggling through this? For myself, I often stop and remember to teach my children certain things. Like I started taking them to the grocery store with me, which is very simple. This is something that you need to know, not for a few years yet, but you do need to know it, because we're so used to just doing these things and we've done it for so long. So how are parents working their way through that idea of, okay, I have to stop, I have to teach them how to do it. And then also they may do it not wrong. I mean, maybe wrong.
It's wrong.
But but they may also just be doing it in a different way.
Right.
Yeah.
And as a parent, you have to step back and just let them do that, and maybe even let them make a mistake. So have you had to work through that, or are there other parents that
Yes.
how they work through that?
I mean, the stakes are higher when you have a chronic illness. It's like, okay, your kid grows, is off to college, or, in their 20s, and maybe they haven't gone to their dentist appointment, right? And it's like, well, that's bad. You have to take care of your teeth. But when you have an IBD or Crohn's, when you have Crohn's or colitis, it's like you have to take your medication on the scheduled time. You have to follow up with your procedures or your doctor or whatever it is. So it's not like you can just say, when we all have kids, so it's like, well, they're going to have to fail and figure it out on their own. But there's not. The stakes are higher. So that's why, even in talking to other people, who don't have a child with a chronic illness, they don't understand that it's not as easy as just saying let them fail, because you have to really be on top of these things. So I'd say from myself and from other parents I've talked to, they worry that their kid isn't going to take their medication, whether it's an injectable medication or if they have to get Remicade, or even if it's just an oral medication that they're taking. They can't really they don't know, so that's compliance. The compliance of medication, I think, is one of the biggest concerns that parents have. And then, but that goes back to, building this up in your child for them to sort of take over. It's not just about how are they going to do it on their own. It's that they have to be invested in their own health. And, there's only so much you can do as a parent to get them to do that. But again, seeing you be taking care of yourself, all of those things are really important. If you ask me actionable things that parents can do in terms of getting their child who has IBD to be more independent, is very simple things that you might not even think about, make sure they have their doctor's phone number in their phone, you know what I mean? And they know sort of the protocol of how, or, if they can get in touch with them on the portal, make sure they are on their portal and can look at their medical record or contact their doctor on their own if they need to. I mean, these things seem like small things, but as we were talking about with kids in general, we need to break it down to the smallest step. Yeah. So, I would say that's one of the first things, having a picture of their insurance card, in their phone, so that when they're asked about that they can access it, because they're not going to be fumbling around finding it, or they'll call you and say, how where's my insurance card? So, and then the last thing I want to say about that is, when the child does turn 18, it is really nice if they will allow you to still be involved. Like my son was like, yes, sign things. You can talk to the, whoever it is. But some kids don't want that. And so that's okay too. But it is beneficial to them, because like I mentioned, my son still wants me to help him deal with like health insurance and like getting his specialty medications. There are a lot of things he does on his own. Like he'll email the doctor on his own. He'll make doctor's appointments on his own. He'll go to the regular pharmacy on his own. But like, there's things that, they don't make it easy, as you guys probably know, the insurance and the pharmacies. So, he still is asking for my help for that. So it's nice that I have, I don't have to every time call and have them, it's a pain. Like they talk to him, but you just have to sign something. He has to sign something saying it's okay.
Your suggestion of taking a picture of the insurance card kind of triggered something. I'm the patient, my child is not. And so I've always tried to make sure that he has had all the tools just in case something has happened. And I started creating very in-depth contacts, like in our address books on our phones. So he has all of his information and I share it back with him. And I've shared my contact card in there with him. And that has like, just in case anything happens, it has my information, my medication, my insurance information, his insurance information, his school ID, like all of that information. And it feels better to me, like now that he's going out more with his friends and he's doing other things, to be able, I just know that he can look in his contact sheet and he's got all the information. And I also feel like, like you said, that's kind of baby stepping them towards this avenue of independence. I mean, they're always going to need their mommies. any kids listening, I just want you to know you're always going to need your mommy.
I attest to that. It's true. Yes.
I cannot stress that enough.
Yes.
But it is important and it feels good too, to be able to know that that your kid is safe and they feel confident and comfortable. We just recently went to a doctor's appointment and they asked for Jackson's medical record number and he pulled out his phone and was like, "Oh, I'll do it, Mom." And I'm like, you're getting there. It's so important, especially, when you're dealing with a chronic condition, you just feel, you want your kids to feel safer. More
but it's
confident.
also like, it sounds like he felt empowered. And I think that's another thing, is for them to feel like empowered. It makes them feel empowered, even those little things. Like I know Lowell feels better. Like he'll be like, well, I did that on my own, or I made this appointment already. I mean, sometimes I go with him still if he wants me to an appointment or not, but it definitely makes him feel better to, being able to do some things on his own. And people in the IBD space know that every patient is different. Every patient has a different severity of disease, different amounts of time when they might need to go to an appointment or check in with their doctor. So Lowell's tends to be pretty severe at some points. And so we have a lot, we do have a list of all of the different doctors and all of the different ways of contacting them. And so we both can do that. And I will say to him, do you want to do this? Or do you want me to do this? Or are you going to send them a message on the portal? Do you want me to help you? So it's a conversation. But I do think that, when your child is getting ready to maybe go away and leave the house, that these are, having actionable items, and, there is going to be some failing, what I mean? And hopefully it's not, the biggest, it won't be the biggest mess up for them, but are going to have to figure it out on their own. They are going to have to figure out how to, go to college and find a place where you can get your infusion, or if you still need help getting your injections. And, it's possible to do those things. And I know a lot of parents who have done that. I just want to say one other thing about when you said things that parents are concerned about. Another thing, and this is important for them to talk to their doctor about, is like if you're going to college or even high school and you're starting to drink, or that's a really important conversation, because there are medications that it's really not okay to have substances that are not prescribed interact with them. So parents have a lot of concern about that, I would say.
Yeah, and here's something in talking to physicians and parents and addressing this issue is the idea of when the parent starts to step away. And we are talking about young adults, 18 plus, that even if you are still involved in their care, there may be issues for which your child, who is your adult child, may want privacy for certain things, which is totally understandable and makes sense. Drinking would be one, sex might be another. I'm sure there's more. Should the parents offer to leave? Should the physicians take the lead in that? Like, at one point, does there start to be an even more pronounced separation because there needs to be?
I kind of think the physician should take the lead in that, because there might be a kid or a teen who will say that, who will say, I would like to have some private time with the doctor, but I don't think it's that common. And I do think the physician, especially an IBD physician, should have that conversation. Or like when you're in the appointment, either just say, I'm going to talk to the child alone, or can your parents step out right now to do this? Or just make it a thing, like they have to. I really think that is important. I mean, I think you guys will see, even maybe with the child's pediatrician, they'll start doing that. I think. I don't know if they have already.
Yeah, that was definitely. I just had that.
Yeah, it just happened recently.
It just happened, and it was so jarring.
Yeah.
Because I do believe in privacy, but I think that I've just been on automatic.
Yes.
So when the physician looked at me and he's like, Mom, do you mind stepping out?
Yeah.
I was like, does someone need water?
Right.
What
Is there some surprise or something happening?
You know what though? I didn't know it was coming.
Yeah.
Okay, no, I knew it was coming. I didn't know it was coming that day.
Right. Right.
So it was a little like, okay, you need your space or whatever, but this is weird for me to be sitting on this little bench in the hallway while you're in the appointment.
Yes.
So
yes.
Yeah.
So I don't know. I know you've spoken to some doctors. You're going to be speaking to some physicians about this. And I think that is something that the doctor should initiate, especially if they are going off to college, because it's a very important conversation to have in terms of the medications and, the drugs, sex, whatever it is, it's important. So,
but I remember being that age and like having it might have been like my third or fourth gynecologist appointment. And my mom just got up and walked out. She didn't even, and I was very grateful for that, because even though I was very like communicative with my mom and, could talk to her about things, I didn't want her to think that I needed privacy because I was doing something that she wouldn't agree with.
Right. Yeah.
But at the same time, like I did want to talk to the doctor without my mother's, not necessarily influence, but just her input. I just wanted to have a conversation with another adult. And before I was very grateful. Before I could even say anything or the doctor could say anything, my mom was like, I'm just going to step out for a minute and let you guys chat. And that was it.
I think that's a good point. I think that's a really good point. I think for parents, for them to be thinking of that as their child's getting older and they're going to these appointments. I think I've done that with my son, but more in like maybe therapeutic settings, or, when we've maybe been talking to a therapist or someone together, and I'll ask him, do you want me to leave? Do you want me to stay? But I think it's actually pretty good to just say, I'm going to leave, because that's like you don't have to have them, if they feel like, oh my God, I'm going to offend her, I don't want her to feel, so I think that's a good point to bring up, that the parent can start thinking like that as well.
Yeah. I mean, even as an adult patient, sometimes it's just helpful to have someone else in the room to remember or to ask questions or to think of things that you're not thinking of.
Yeah.
But that's not really necessarily the reason,
Right.
It's because they're adults and they're going to have their own lives and they're going to do things that we disagree with.
Yeah. Yeah.
But also I kind of like, you want that a little bit too.
Yeah.
Absolutely.
Yeah.
And maybe that's goes in with the making the mistakes, and hopefully it's not a mistake that sets off a flare up.
Yeah. But I mean, but I've also talked to parents where their kids have done that. Like they've missed their, medication by a week, and then they start feeling bad, so it's not like it's not necessarily going to have these terrible consequences, as though as parents, we think that, right. But those missteps are going to happen with any kid, but especially with the chronic illness, they are going to do something that's not like the way you would do it. So
it happens with adults. There have been times when I've looked up and been like, oh, I need to go pick up that prescription.
Yeah.
Like I am 2 days late on that.
Yeah.
Because also just dealing with a chronic condition is just, there's so much that goes into it.
Yeah.
But I also feel like when you feel like your parents trust you, you act a little bit differently. I always felt like my mom trusted me. I felt comfortable with that, but also I was focused on being a little bit more responsible because of it.
You were like wanting to earn it.
Yeah.
You know,
No,
you don't
but
have to earn it. It's given to you.
Right, but I wanted
But
to.
you wanted to behave
Yeah.
in the way that, you know, she knew that you were behaving
I think
in the
that's
way
an
that she would
important point,
prefer.
actually, for parents, and even for the physician to like put that confidence in. That helps with their confidence. So like, you know, when you're telling them about something or describing something that you do for them, maybe it is, you know, like doing the refill to the pharmacy, like just doing it in a way that you know that they're going to be able to handle it. So it does give them confidence, and it just builds up, you know. So like when you asked the question before when to start doing that, I think there's really no too young of an age to start doing it. Like it's based on your child's maturity. You know, 12, 13, they could start doing little things. And then also I think it's important, I don't know if we touched on this, but for the physician who's dealing with this population to really be talking to the patient, just as much as they're talking to the parent, but like address the patient and allow the patient to answer some of their questions, you know, as they're getting older that they always ask, and, you know, not having the parent jump in all the time.
That's a thing, that the uncomfortable silence sometimes with the you know, my kids don't live with an IBD, but their pediatrician talks to them. And it has been an exercise in patience for me to sit there and not try to answer or prompt or anything, and just sit there and let my kid answer the question, because what's going on in the back of my mind, we have 15 minutes for this appointment. You need to get this out. We need to keep this moving, you know, and that's my own bias. And so, but I do try to sit.
Details. Like my kid will actually look over at me because he'll say something.
They always
and
look at
I
me.
may just have, you know, my resting mom face, like, you missed something. I'm sorry, but you definitely had that double cheeseburger for sure.
Yes.
Well, usually with my kids, it's usually they leave out their accomplishments. You know, the doctors will want to know them as people. And here's the thing too, is I think we want to go in as patients and be like, everything's good and everything's fine. And we want to make our doctors happy in some kind of weird parental way there. But so what do we do about that? What do we do when the kids or adult children are resisting taking over, or are resisting being forthcoming? Like, how can we support them in that? Is that on the parents? Is that on the physician? Both? Maybe.
Yeah, I think that there is some pain points. Like I've definitely had that with my son, where I don't feel like he's giving the information he should be, or he's not contacting the doctor in the timeline that I think he should be. And so even as I'm talking about this, I'm realizing, there are things that, you know, I've had to let go of, even with his chronic illness being so, you know, important to like be on top of, you know, but I have had to let go of some things. Like, you know, if the doctor was saying, well, maybe we should try looking at this diet or this food or whatever, and it's like, he doesn't want to do it. I mean, it's, you know, if he wanted to maybe try to feel better, I'm not sure if it's going to make him feel better or not, but if he, you know, it's like there are things that he has to be invested in on his own. And I think that as parents, I even tell parents of younger kids, especially when they're talking about diet, I say, you know, some kids will be amenable to these big diet changes and it's not going to be so disruptive, but some kids it is going to be very disruptive, and you have to weigh that out in terms of how much it's actually going to disrupt your family life, the relationship, their friends. It's not like we always think, oh, well, we have to try this diet because it's going to help their health and it doesn't at all costs. But no, that's not accurate. You know what I mean? It's like, what is the other cost of it? You know, and without really knowing if it's actually going to help, you know? So, I mean, obviously there are times when you have to do certain things, you know, with eating certain things, but when it's just something like that, it's not just simple. It's like, you have to look at all the other aspects of it as a parent. So
the fight may be more than the benefits that you might or might not receive. I think knowing that, and you know, sometimes kids are just not going to do a thing. Like, they're just not going to.
Yeah, I mean, they're still people. Listen, my doctor tried to convince me to stop drinking coffee. It ain't gonna happen.
Yeah. Well, you know, why would someone tell you to stop drinking coffee?
I feel like sometimes he like tries it, you know, just to see how far he can go. That was too far.
Yeah, that was too far.
Too far.
That, you know, I get that. So
that. I can totally get it, you know, being 13, 14 and someone saying like, you know, no, you can't have fries. No, you know, now.
Or you can't, you know, you're going to go to this birthday party and you're not going to eat the pizza or the cake. You know, and again, some kids are like, okay, you know, or they get it, they do it for a couple of days and they start to feel better. And then maybe that, if it happens, they'll motivate them. But not every kid is like that. And we have to like sort of work within your family and within your child's, you know, what their personality and how your relationship with all of that. So
at what point should the doctor initiate that conversation about when they should be transitioning and what they should be thinking about for the future of their care?
Another important thing in terms of the transitioning, whether they're leaving the pediatric doctor and going to an adult doctor or not. I mean, and if they are going to switch, that's, they have to be in part of that process. If they want you to be involved in like meeting or interviewing a doctor, then that's important. A lot of the pediatric doctors will see kids until they're 21 or older. So that's a conversation that you have to have about how long they want to be in this doctor's care. But then I think if they're leaving or going off to college or going on a trip in high school, whatever it is, that the doctor actually lets the child or adolescent or young adult know what their requirements are. Like, you need to, have this appointment with me, make sure you have this amount of medication with you. So it's important for the doctor to have that conversation with the patient.
As the co-founder of Connecting to Cure, you're working in the IBD space. You're helping patients and families and children and parents. Can you tell us more about your foundation and then let us know where we can follow you?
Sure. So originally, I think I mentioned this, we started Connecting to Cure Crohn's and Colitis because we wanted to be able to have a grassroots organization that raised money for IBD research, because at the time, me and my co-founder had younger children and we were worried about their future, and we wanted to make sure that the research that was being done could still be being done and could be very robust, and there was a lot of money to support that, because we all know research costs a lot of money. We also wanted to have an event and a way for our friends and family to participate and help us, because so many times they'd be like, how can I help you if you're, if my son was in the hospital or whatever it was. And, there were things that they could do at those times. But I think that really when we started doing our events and fundraising, people really do feel good about what they're doing by supporting us, and they feel part of our community. And I did notice that that really helped, and they are helping, and we value, anyone who donates, anyone who volunteers, or anyone who wants to, be a part of our community. And then another big part of what we do now, and even more so since the pandemic, because, people with IBD, were maybe more a little trepidatious about going out. Of course, we all were, but, some patients are still very concerned about it. And, we don't know exactly, the jury's out on, how COVID is affecting people differently. But our community was growing before that, but now it's very strong in terms of the support that we can offer, either peer-to-peer support, like we have a mentor program and this can apply to the topic that we were talking about, is that if you have a child who is starting to transition and there's like an older teen or young adult who's already gone through that, we can pair them up. We have a mentor program for older patients and teens to pair up with younger kids who are newly diagnosed or going through a transition. We have our patient support groups. We have caregiver support group. We partner with another organization, the Crohn's and Colitis Young Adult Network, to do a sibling support group, and also includes children of parents who have IBD. And we have an IBD workout that we offer every week. And we also are just available, like if anyone needs to reach out to us. And then, of course, like all IBD organizations, like both of you have, we want to raise more awareness about these diseases so that we can bring more resources to all the patients who are really suffering and the families who are affected by these diseases, I should say.
Yeah. So where can folks follow you?
Our website is connectingtocure.org. We are on Facebook, Instagram, and Twitter at Connecting to Cure on Instagram, and Connect to Cure on Twitter, and Connecting to Cure Crohn's and Colitis on Facebook. Not on TikTok yet, but I'm I don't know. Yeah.
We just need to do like a cool moms TikTok.
Yes.
I'm obsessed with this cool moms idea because, the children, they don't think we're cool, but we are. We are super cool. Stacy, it's been amazing. Thank you so much for coming and sitting with us and chatting with us. Appreciate it.
Thank you for having me. It's been, I love you guys, and I'm glad anytime I get to talk to you guys about anything. And I'm especially, honored to be on this podcast and to help you guys with what you guys are doing with IBD moms.
Hi, this is Jax, and you're listening to my mom, Brooke Abbott, and my aunt, Amber Tresca, on the IBD Moms podcast. Just because I don't listen to her doesn't mean you shouldn't.
Brooke, I think you need to have a mommy meltdown.
Oh, I've had one, maybe two since I've been here in San Diego, but I had one. First day, landed 5 minutes into the trip. Totally irrational. This is probably like the most first world problem I think I've had in a long time. But you know what grinds my gears? I mean, really.
No, but I think you're going to tell me.
Ooh, just gets me into a tizzy. When I look at a menu and I decide on something, and then the waiter tells me that it's not available and has not been available for months. Why is it still on the menu? I walk into, where were we? We were at some restaurant.
Yeah.
Walked in there. I'm looking at the menu, and these little tiny bite-sized crab cakes, they jump out at me. They were like, Brooke, this is what you want to eat right now. And I was like, yes, this is exactly what I want to eat right now. So I get my whole order together, and I look at the waiter, and I go, can I have the tiny crab cakes? And he goes, oh, I'm sorry, we're out. And I'm thinking he's going to say, we're out of them today. He said, we've been out of them for 2 months. Why are they still on the menu? That's just my problem. I just really don't like that.
Mm-hmm. I feel like there should have been a sign at the door, probably.
Or, you know, when you hand the menus, say, like, this is what we're out of.
Mm-hmm. Mm-hmm.
There's just a little extra communication that I feel is necessary, that people... I just don't like, if you know that something's not there, don't wait for me to ask for it. Mm-hmm. You just wasted my time, and I'm also like, and craving.
Now I'm mad.
I'm mad, and I'm craving crab cakes, which I never really craved, but now I'm craving them more and more because I could not have them.
We'll have to get you some later. I feel like this happened, though, again, at Starbucks today, right?
Oh, it sure did.
And I am going to call out Starbucks because I don't care.
Oh, for sure it did. For sure it did. Walk in, you know. It's a full-on conference. They should have all the drinks that they need to have in order to fulfill the actual drinks. Blonde espresso is a thing for me because it's a lighter espresso. It's got a little more caffeine, but it's just not as harsh on my belly. Walk up there. I'm all ready to have my nice frothy caramel macchiato. I needed coffee. Got the day started off kind of rough. No blonde espresso. None. Mm-hmm. Absolutely not. It was a tragedy. It was a pure Shakespearean tragedy. Because then I had to have the regular espresso, and now I feel like I have rocks in my stomach. So thanks a lot, Starbucks. I got rocks in my belly because, well, that's probably not the reason, but I'm blaming it on that because I'm very upset.
Well, you know what? I would just like to point out that Occam's razor, probably the simplest explanation, is the one that is applicable.
Absolutely.
And you drank that coffee and then you started feeling this way. Mm-hmm. So I feel like that's right. And I don't think that they're ever going to be a sponsor. So I'm not too concerned.
I'm not concerned. And, you know, let's be honest. I'm going to continue to drink it. I'm just mad. I'm just, you know, I've got a little fury right now.
Yeah. You just needed a minute to get it out.
Here's the thing. As a mom, we don't always get what we want or have the time. So when I go to a restaurant or a cafe, like I just need that one thing to happen because that may be my only escape from motherhood. And I just want to live in the crab cake and blonde espresso dream. And, you know, that didn't happen for me this weekend. And, yeah, thanks a lot. Well, we just want to thank Stacy Dylan from Connecting to Cure Crohn's and Colitis for coming on the show and talking about how to transition your pediatric patient to adult care.
Transitioning to adult care can be a little rocky, and Stacy really has been through it all.
Stacy's a rock star, and we love you, Stacy.
You can follow Connecting to Cure Crohn's and Colitis on Facebook, Instagram, and Twitter, and on their website, connectingtocure.org.
Guys, we made it to episode 2. Links to a written transcript, everyone's social media handles, and more information on the topics we discussed is in the show notes and on the episode 2 page on ibdmoms.org.
You can follow us across all social media as IBD Moms.
IBD Moms podcast is written, produced, and directed by the IBD Moms, Amber Tresca, and me, Brooke Abbott.
Mix and sound design is by Mac Cooney. Theme music is from Cooney Studio.
Let me just flow it out. Okay.
All right.
Okay. Okay.